Good evening, everybody. I'm Sebastian Uiweijin. I'm with my partner Simon. We hope you have a great Friday night, and we thank you for joining us for this Friday night of the QIUP Virtual Public Health Campaign.
Today we have zoomed in on the dietary aspect of avoiding hypertension. We shared recipes for 3 delectable dishes that are nutritious and easy to make, and you can check them out in our Instagram and Facebook.
But now we're going a bit deeper. We're honored to welcome our medical and nutritional expert to enlighten us on where does our eating habit go wrong. Joining us from all the way from KL, Dr. Chin Xing Ming. Hello, Dr. Chin. How are you today?
Hi. Good evening, everyone. Good evening.
Good evening, Dr. Chin.
Good evening, Dr. Chin. So how's your day today?
Today, fortunately, is my off day, so I did have some time to rest and then also to prepare for this presentation. So what about you? I see that you guys have been doing great online.
Yeah, we're doing great. We've eaten a lot of food during these trying times.
Nutritious, of course.
Nutritious, yeah. But we have a big question for our audience today. How do we get to keep our diet healthy during these trying times,
Okay. I will be explaining that in my sharing later. Should we start?
Yeah, we thought we'll pass the stage to you.
Thank you. Okay. A very good afternoon, good evening, everyone. Okay, my name is Siming, and I'm currently a house officer in University Malaya Medical Center. Okay, I graduated from National University of Ireland, and I'm also a strong advocate of nutrition and a nutrition advisor. Okay, and what motivates me to look into nutrition is that I've always believed that the greatest medicine of all is to teach others how not to need it. Hence, that's why I've been broadening myself into the nutrition area. Okay, so today my topic is what did it go wrong with my eating habits? Okay, first of all, I have to thank Quest University. I'm really honored to be invited to give this talk and sharing about and also help in public health awareness in hypertension. Not to forget, I would like to especially thank Ms. Gan. I'm impressed with her dedication and also passion with not only her and her team in doing more for public health. And they are all at such a young age. I'm very happy to see teenagers nowadays being so passionate about public health. Okay, let's start into our topic because today the campaign is mainly on hypertension. Okay, what I would like to start with is let's go through roughly on what is high blood pressure. Okay, so high blood pressure is actually like a story. So high blood pressure happens when the force of your blood is pushing against the wall of your blood vessel is too high. That means something is pushing through your pipe in your body and it's too high. Okay, so what happens? The main pumping system is our heart. Okay, it works by pumping the blood through all our longkang in our bodies. Okay, they are the arteries, they are the veins, and the capillary. Okay, and this blood pressure, is the result of two forces. Okay, one is the systolic force. Okay, where the main pumping, the heart is pumping, that's the force that's pumping. The second, diastolic pressure, is when the heart rests in between the pumping. So these two make up your systolic and diastolic blood pressure that you always see when you do check up with your doctors. Okay, so what is the story about high blood pressure? How does it happen? Okay, so it happens when, our longkang in our system is not like the plumber in our house. The plumbing and piping system in our house, we get to change when it's blocked or when it's old or when we move to a new place. Okay, but our body, we take it with throughout our life. So it happens when we start to get a bit older, okay, when we are old, the aging process take in, the big arteries start to become a bit stiff, okay? Normally it pumps, okay, if you can see the normal pumping, it works like this, pumps really well, okay? So when the heart is pumping, the surge of systolic blood pressure, your blood vessels will expand. And then it also can contract when it has to rest, contracts and expand, okay? But when we have already aged over time, you will see the arteries couldn't expand and contract at it normally will. So this results in increased pressure in pushing the blood through. So your heart have to pump harder, okay? And then even all your arteries and your heart ventricles, when it pumps harder, all your arteries and veins have to work harder too, okay? Next is when over time, okay, the force of the high blood pressure, okay, imagine you always have very big pressure pumping your longgang in your body. After some time, the high blood pressure causes all the longgang to hurt them through the inside of the walls, okay? So your blood vessels start to have hurting around the side, and then there will be damages to the delicate tissue inside the arteries, okay? So in the end, the blood cholesterol form along. Okay, what does it happen? When you hurt your blood arteries and also your blood vessels, when you hurt them at the site, they will form, we will call it homocysteine and also the bad cholesterol, LDL. With inflammation of the body, it will cause plaques to form around it. Okay, just like our longkang, when there's a blockage, when you actually damages the longkang site, you will form like, all those dirty things will go to the side, right? Just the same as, you know, when we see our longkang, when there's hole, the dirty things will go to the hole. It's the same as our blood vessels. So that's when LDL and plaques start to form. When this, we call it atherosclerosis. When this start to form, it will further causes the normal longkang is so big. Imagine all those dirt, those oils start to form at the side, it will start to become smaller. Okay, hence, when you have smaller longkang, to push the same amount of blood through, you will need to use bigger blood vessels. Okay, so look at this picture up here. You will see this is when there's normal, when you hurt it, and then there start to be homocysteine and LDL start to form, and inflammation of the body start to make the plaque to form. And when this is when your arteries start to be narrowed. Okay, okay. So normal pumping and this. Okay. So after, imagine, long time working, it becomes stiff, can't really pump. Okay. And then the dirty things start to build up, and then your blood pressure need to, your ventricles need to work harder, your heart chamber need to work harder and harder. And in the end, your heart just have to pump so hard that it starts to become tired. Okay. The extra work causes the ventricles wall to thicken. Ventricles is where there's 4 chambers of a heart, and then the bigger chambers where its main responsibility is to pump blood throughout our body. The chamber starts to become thickened and it becomes less flexible. This is when your heart starts to become heart failure. So this is a story of aging, a story of plaque and also atherosclerosis happening, in the end leading to heart failure, which is all started by high blood pressure. Okay, so today we are focusing on high blood pressure. Okay, right? So high blood pressure, what do you say when a person has high blood pressure? Normal pressure is around less than 120 to 80. I think we are all very familiar with it. But we say that when it's high blood pressure stage 1, you're having hypertension stage 1, when the reading is around 130 and around 80 to 89, above 80 lah, okay? So you start to have hypertension when you're 130 for your systolic, and then more than 80 for your diastolic, okay? And okay, so we are talking about hypertension today. But what I would like to highlight is that hypertension, okay, will also, I'll show this first, high blood pressure and metabolic syndrome. This is something very interesting that I've read in the American Heart Association, okay? So we are talking about hypertension today, but remember that our body is made out of multiple organs, okay, and the organs form systems. Similarly, high blood pressure and metabolic syndrome, high blood pressure is linked to many clusters of diseases. You will see a lot of patients coming into the hospital not with only high blood pressure alone. They will come in with a cluster of diseases, and this cluster we call it metabolic syndrome. Okay, or we also call it insulin resistance syndrome. Okay, so metabolic syndrome refers to a cluster of risk factor. Okay, and then when you have 3 of these risk factors present, we diagnose you as having metabolic syndrome. And what are the 3 risk factors? The first one is high blood sugar, which we call diabetes. Okay, these are the few friends. And then you have low levels of LDL, blood cholesterol, and then high level of triglyceride, which this is formed with high cholesterol. Okay, and then you will also have some sort of obesity, where you have apple-shaped body. What do you mean by apple-shaped? Apple-shaped, to say generally, you will see more guys have apple-shaped body where they have higher waist circumference, they have big tummy, okay? And then more women tend to have pear-shaped body because we have bigger lower limbs, bigger buttock, okay, that kind of size, okay? So that's obesity. And then you get high blood pressure. This cluster of diseases come together. So I will say they are a group of best friends, a group of 5 best friends. Normally, we'll see patient coming in with obesity first. Okay, you start to get overweight, you start to get fat first. Then the high cholesterol, high blood pressure, okay, high blood glucose, which is diabetes, and also high uric acid tends to all come together. Okay, so this is what we call the 5 good friends. Okay, so today we are talking about what did it go wrong with your eating habit. Okay, so with your eating habit, first you have to prevent all those 5 friends coming along. It doesn't matter just that, okay, since I'm having high blood pressure, it's okay for me to eat sweet food. No, it doesn't work this way because they all come in a cluster. And as you can see, what links really closely with hypertension, high blood pressure is high amount of cholesterol in your body, which is the fat just now that we saw, and also actually high blood glucose. And what leads to these two is actually obesity. So all of these 5 friends are linked together. So today when I want to talk about what did it go wrong with our eating habit, I'll be focusing a bit on hypertension, but generally I'll be focusing on how do we get rid of these 5 friends in order for us to lead an optimal and healthy lifestyle. Okay, so first, I will need to say everything comes from being overweight too. Just a kilogram a year can really add on. In fact, obesity has been classified as the mother of all diseases. Once you have it, all of it come together. And obesity is not only a phenomenon or symptom, it's a chronic disease. Okay, it's classified by WHO as a chronic disease. So let's look at Malaysia. Very sadly, we have the highest overweight population in Southeast Asia. We are the champion. Malaysia number 1. Okay, we have the highest number of people being obese and also the highest number of childhood obesity in Southeast Asia, unfortunately. Let's look at, okay, what can we change from our diet? Okay, I will highlight a few food that is definitely a no-no for hypertension first, okay, just to highlight the main point today. First is food that is high in salt and sodium. Okay, you will be amazed, not only salt are actually high in sodium. A lot of canned soup have hidden salts inside. Our ham, those processed food, packaged food, okay, even vegetable juices that you drink outside, unfortunately. Yes, okay, they will add on salt, especially, you know, those tomato juice. Okay, it's very nice when you add a pinch of salt. Okay, and also butter. Okay, salted butter, cheese. Okay, all of the pizzas and gravies outside that you have, pickled things, they are all very, very high in sodium. Okay, but salt, okay, and some salt myths too, to tell everyone. Myth number 1, everyone always say that pink salt is healthier than table salt. Okay, or sea salt, Himalayan salt is the healthier salt. Okay, they are healthier in the sense that they have mineral. So instead of just getting sodium, you get other minerals into. But apart from trace minerals, they have minimal additional nutritional value to table salt. And they still add to your daily salt intake, to be honest. So you actually eating them also increase the sodium intake in your body. So beware of taking in salt. Okay, this is the salt myth. Second myth is that salt is the natural product that's needed for good health. I need salt, I need sodium, potassium for my body to function, which is cool, which is true. My doctor always look at my sodium potassium level in my kidney function. Okay, I need the cellular level for the sodium and potassium. Yes, that's true. But the problem with salt intake in our body is not whether how salt damages our body. The problem is with our eating habit. We are eating too much salt. So our body does need the salt, but you will get enough of it. Okay, salt is something that you don't have to look for. Like sugar, you don't have to look for it. They are in all of our daily intake nowadays. Okay, the third one, if it's high in salt, I'll be able to taste it. Everyone will say, this is not salty lah, can eat lah, this shop is good, not salty. Ladies and gentlemen, MSG have salt too. Okay, and then you cannot trust your tongue to tell you whether is it salty or not, surprisingly. Our tongue is very deceiving, okay? Mild or bold, bland tasting food can be high in salt too. Especially, do you know that actually your daily morning cereal is high in salt? And something that is sweet doesn't mean that it's not salty. Trust me, to make a nice cheesecake, you need to have the amount of salt that's needed to make it taste nice too, with the same amount of sugar. So everything to make something sweet, you don't want to make it bored, you want to say, how do you say it? 不要吃腻, you don't want to make it, you don't want to make the sweet taste to be too overwhelming. You actually need to add in salt to make it nice. So salt is like everywhere, just like sugar. Okay, so tips to cut down on salt. First, you need to choose low sodium food. Okay, read the labels. It's just actually cutting down on salt and maintaining a healthy habit. Because I've done many sharing on how to maintain a healthy lifestyle and also on weight management. I've always tell people about calorie counting, about carbohydrates. But in the end, when I read through the topic today, again, I noticed that actually cutting down salt is just like cutting down fats and also carbohydrate in our daily life. So they actually all, again, come in a package. Okay, so first, you need to read your food calories, read your salt label too. Okay, and avoid high sodium food, especially pickles. And also, we like to eat those salted egg chicken. Those are very high in sodium, okay? MSG food, and also be creative with your food preps. I really like Quest University, what they're doing. I saw that they're having a fried zucchini, like zucchini noodles tomorrow, on Sunday. That's very interesting. How can you be creative with your food, not only in terms of cutting down calories, but also in how do you season your food. Use spices, herbs, lemon, garlic, vinegar, and pepper. They are better. And I will also share a bit in the end of my sharing about home cooked meal. They are very, very important too, because unfortunately, we only go to restaurants with food that tastes nice. And in order for food to taste nice, they really need salt. So in order to cut down in salt, one of the crucial steps for you is to cook home cooked meal. Okay? Okay, today what I would like to tell everyone, okay, we have covered a bit about what is a definite no-no in terms of hypertension in your eating habit in terms of hypertension. Okay, but now I'd like you to bring a broader view of how to be healthy, what went wrong with our eating habits in terms of optimal health. Okay, so the optimal health doesn't only compromise of eating habit, it does compromise of the 6 pillars, okay, which is eating habit, exercise, the first E, we need to earn our optimal health, so we say E, eating habit, exercise, mental attitude, the A, rest, nutrition, and also stress control. All of these make up our optimal health. But today, I would like to bring everyone focused into eating habit with compromise 70% of our health. Okay, so first, in order to know what went wrong with our eating habit, first you need to know how does our body balance work? Okay, so our how do we control our eating and also expenditure of our body expenditure? It depends. It's like a balance of a scale. Okay, our input based solely on our calories that we eat. Okay, our output depends on thermic effect of food, energy expenditure, and also our BMR. Okay, if your weighing scale tilts more towards the calories that you eat, you'll become like Puma and Pumbaa. I think Pumbaa is the fat one, right? This from Lion King. Okay, and then if you have that tilt towards the other side, of course, where you have more expenditure, okay, you will actually be. You will see it from your body shape, as illustrated by the picture. Okay, so why do we say eating habit compromise 70% of our health? Is because all our input depends on what we put into our mouth, and what we eat depends on what our body grows. Okay, if you eat all the fats, of course your body will turn them into fat. Okay, if you eat the protein, of course your body will do more muscle. So our mouth is our number one culprit. Remember, fitness is always 20% exercise, 80% nutrition. You can never outrun your fork, unfortunately. Okay, I personally truly believe in this because eating is one of my favorite hobbies. So I'm also trying to adapt a healthy lifestyle. Okay, and I'm from Penang, so imagine the food in Penang. Okay, and also 80-20 rule, you'll always hear it in those people who really look into fitness nowadays. No matter how you exercise, you may be fit, but you may not be healthy. number one point. Second, in order to be healthy and fit, 80% of it comes from your diet. Okay, but I understand we are all very busy people, including students nowadays. See, even on their non-schooling days, they have to do this public health campaign. They are also very busy people. So what do we put in our mouth? We are all tasked with multitasking ability nowadays. We need to do so many things in our life. Okay, so what do we go for option? We go for Food Panda, we go for GrabFood, or we go for the canteen downstairs. So because we have so many things to do, we are just too busy. And we also go for fast food. We need things to be ready on the spot. Okay, and also the milk tea, our favorite pastime, KFC, McDonald's. Okay, so first, before we look into the eating habit, you need to understand how much do you know about healthy eating habit? Because there are different types of cluster of people who, before we can cultivate a healthy eating habit, you first need to understand yourself first. Are you those type 1 of people who think that we only live once, guys? Okay, eat now, think later. Okay, you can just eat. So you're a type 1 cluster. Type 2 cluster is that I want to be healthy, but how? Because whether do you believe it or not, healthy lifestyle come with knowledge, okay, and also practice. So how do I do it? Type 3 people is I have the knowledge, especially I think a lot of Quest University students, they have the knowledge, but I'm just too busy and tired for all of this. Having something in my tummy is enough. So this is type 3, we are just too busy to be bothered. Okay, like a lot of my friends working and my colleagues, we are just too busy to bother about healthy lifestyle. Okay, type 4 are those people that we really want to be. Okay, I have the knowledge and I'm practicing it. Okay, what I would like to share with everyone is that being healthy is a process. It's a lifelong process, just like keeping fit and also managing your body weight. It's a lifelong process. Don't think that you have to be 100% healthy. We are not advocating everyone to say from today onwards you're only eating salads, okay, and all the greeneries. No more char kway teow, no more curry meat. No, we are not advocating this type of lifestyle because it's not long-term. It's not a long-term plan. It's very difficult to sustain. What we are saying is that start from small choices, change your small choices, okay? And then by doing little changes in your life, then you can lead to big change. Okay, and it's a lifelong journey. So we are all trying, even whether you're type 1 today or you're type 2 or you're type 3 cluster today, we are all working towards to become type 4 people, slowly but eventually, okay? Because our body needs us to take care of it. We need to slowly take care of our body, okay? And when, especially as a doctor, especially since this morning I've been starting my housemanship, I've been always overwhelmed by all those sick people that I see in the hospital. And when you see them, and when you see them by the sick bed, you won't think that YOLO is an option really, or YOLO is an option, okay? Because those pain are really worth little effort that you can change in your daily life. Okay, so what I would like to raise today is the awareness of all of us trying to work and become type 4 people, slowly but eventually. Okay, so let's look at a bit of sources of calories. Before we talk about eating habits, we need to know what sources of calories do we have. Okay, first, okay, normally in order for us to survive, we are all looking at macronutrients today. Okay, besides water, which makes up 70% of our body, water is definitely important. Enough intake of water is definitely a step number 1 in your healthy eating habit. Okay, make sure you drink at least 2 liters of water per day. Okay, exception for those with chronic kidney disease, heart failure, listen to your doctor advice. But generally for general population health, well-being, drink 2 liters of water a day is a basic necessity in order for your body metabolism to work. Second, we look into macronutrients. The 3 main macronutrients that we have is carbohydrate, proteins, and fats. Okay, and also in terms of calorie, 1 gram of carbohydrate is 4 calories. Okay, it's the same as protein, they are all 4 calories. 1 gram of fat is 9 calories. Okay, a lot of people say alcohol doesn't have carbohydrate, protein, or fat. Okay, but 1 gram of alcohol is 7 calories. Okay, guys? Okay, so let's look at how has the healthy food of pyramid evolved throughout the years. Okay, initially we were always taught, especially in my primary school days, so you can know I'm quite old. Okay, primary school days we are always taught that okay, we need to eat those carbohydrates, okay, eat the bread, and then we go to fruits, and then we go to meat, okay? This is how we arrange that, okay? But nowadays, the healthy pyramid, food pyramid have evolved. We are seeing more about I'm not sure whether are you guys familiar with the term of phytonutrients. We are saying about nutrition and also vitamins in fruits and vegetables. So we say eat a lot of vegetables, then the protein, and eat the low GI carbs. We even need to choose our carbs nowadays. Not all carbs are good carbs, okay? And also then we only eat the fats and only a bit of red meat because of inflammation in our body nowadays. Okay, so this is how the pyramid have been evolving throughout the years. But have our eating habit evolved? Okay, remember what I would like to tell everyone today is choice leads to practice. Practice leads to habit. So first, you have the knowledge. You have the knowledge, which is why we have this public awareness campaign today. After having the choice, after having the knowledge, you start to make wise and good choices in your life. By making the choice, you start to practice it. After practicing it for some time, it becomes a habit. So all habit, even sleeping habit, study habit, okay, exercise habit, all of them need to be cultivated. It's the same as our eating habit. Okay. Okay. So look at how does it look like in your tummy? We know how does it look like on the surface, right? But how does it look like in our tummy? So apparently veggies, all are 400 calories. Look, how can veggie fill up your stomach? Okay, so those people who eat a lot of veggies, you will notice a lot of healthy people eat a lot of veggies. Why do they look very slim all the time? It's because veggies really do fill up our tummy because of the fibers, okay? And compared to carbohydrate and also fat, 400 calories of fat, it doesn't even fill up your tummy. So even if you really like to eat fries, for your own healthy benefit, you can drink water first. After you drink the water, you eat a lot of salad first. After you eat a salad, you eat a bit of those whole grain rice and meat first. Then only you eat your potato chips or your fries, okay? You wouldn't be able to eat much anyway because your stomach is all full up, okay? So they are also empty calories. Interesting, okay? Both are 50 grams. Look at the broccoli. It's only 70 calories, but look at the chips. So having the knowledge and making the wise choice is very important. Okay, choice makes up practice. Practice make up habit. Again, I would like to stress on this. Okay, so by making the wise choices, what does it mean? Okay, bihun and kway teow, which will you choose? Okay, if you ask your mother generation people my mother generation people they make their homemade kway teow, they really do this kind of thing. So when they make kway teow, they will say you need a lot of oil so the layer doesn't stick together. So if you want to choose, always choose bihun. Kway teow by itself, without even frying it, is very oily. Okay, even if you have to eat outside, curry mee versus bihun teng, bihun soup, which one will you choose? Okay, brown rice versus white rice. A lot of my friends who is a mother nowadays, they say, my children cannot eat brown rice one. I must let them eat white rice at home. Else they don't want to eat. They will say, tak mau makan. Okay, even my hospital auntie bagilah keluarga makan itu whole grain punya nasi. Tak nak, saya punya anak tak mau makan, cucu tak mau makan. Okay, what I would like to remind mothers and also grandmothers, all of them are out there. Remember, how we cultivate our children since young determine their habit when they are old. So give them the right choice because we are blessed with the knowledge. So start from home. They always say that a children's health depends on what their mother gives them at home. So let's start with having brown rice, okay? So why do we stress so much on this? Because carbohydrates there's two categories: simple, refined, those cakes, biscuits, okay, and also complex carbohydrates, which is whole grains rice, okay, brown rice. These are complex carbohydrates. The difference between them is that there's a quick spike in blood sugar and also more sustainable spike in blood sugar, which affects our insulin, which will eventually bring you to type 2 diabetes. This kind of thing, I'll explain it in our next, when we have the opportunity for our next sharing. Maybe Quest could organize public health awareness on diabetes next year. Okay, but today I'll just let you know there's simple and also complex carb. Always go for complex carbohydrate in your daily choice of life. Okay, it's I'm very happy, and also because I'm also someone who advocates strongly on healthy eating. Whenever I can, I will try. I'm very happy to see that there's actually some economic rice shop that actually offer brown rice option nowadays, which actually give us a healthy choice. So always go for healthier option. Okay, cakes. and those simple sugar less and less. You will be amazed to know that even though this doesn't look like sugar in our body, they all turn into sugar. All right. Okay. So biscuits, cakes, sugars, those white sugars, even brown sugars are the same. And also, what more do I have? Kueh, ice cream. All of these are simple sugar. Cut them down. Okay. Does that mean that you cannot have them? No. Cut them down. Okay. The second main category of macronutrients, fats, we are looking at. We have what? Fats always go for unsaturated fats. Okay, trans fats, saturated fats. My friends, I'm sorry, we need to stop that. Trans fats is the worst. They are all this chemical product. Our body could not recognize them, so they stay very long in our body. Okay, what are trans fat? Our favorite fries. Okay, deep fried food. The oil that they use to fry outside, they are all full of trans fat. And hydrogenated vegetable oils, especially we call them margarine, we need to eat them less and less. Okay, saturated fats. Okay, we get it in butter, we get it in our coconut oil. They are very high in cholesterol too. Less is good. Okay, unsaturated fat are the fats that we like to go on. Especially, we heard a lot about avocado nowadays. Avocado, sunflower oil, and canola oil. A lot of nuts, they are good in unsaturated fats. And one of the most popular fats that nowadays you always hear in the market nowadays, okay, omega-3 oil. I want to say salmon omega-3. One of the sources from salmon. Okay, omega-3 oil, they are the best. Why? They have not only heart protective effect, they have the EPA and also DHA that help our brain and heart. Okay, and they are important for our joints too. So we go for healthier options of fat. Okay, so why is fat so sinister? Especially we are talking about hypertension today. Fat and hypertension are very closely linked. Not only arteriosclerosis, fat is very high cholesterol, high fats, triglycerides. It's very bad for our heart. Okay, so for fat, I think a lot of you know what is subcutaneous fat. Subcutaneous fat are fat below our skin. Okay, those bye-bye meat. You know, when you say goodbye, and then when your triceps and biceps start to fling around, those are subcutaneous fats. Okay, but I would like to highlight today on visceral fats, which are fats around our organs. Okay, those fats are the main fats that is really scary. Because they are fats around our organs. They shouldn't be too much. Their main purpose is to cushion our organ from traumatic impact and then to protect our organ. But sadly, a lot of people have high amounts of those visceral fat, which means you have higher risk to hypertension, heart disease, stroke, and also diabetes. Look at a healthy heart with normal level of visceral fat and also an unhealthy level of visceral fat. What I would like to highlight to everyone is that, have you ever heard of young people who are very healthy, lead very healthy lifestyle, very slim, okay, they are very fit, but one day they are diagnosed with triple vessel disease, heart having problems, or also they have hypertension actually. Why does this come? Or even they have a stroke, okay, stroke at a young age, okay. This is very much related to their eating habit, okay. A lot of them tend to have very high visceral fat around their organ. So if you don't know what's the visceral fat in your body today, it's good to find out. Okay, what's the visceral fat of your body? Okay. Okay. The last macronutrients I would like to highlight today is protein. Okay, protein has always been what we call the most, we'll say, healthiest and most favorable macronutrients that people in the fitness industry want nowadays. Okay, so they will say a high protein intake has shown to boost metabolism. Okay, because it increases your BMR, and also they will help to burn. You know, they have the thermic effect of the food. For protein, they actually burn when you need to digest your food. You need to burn some of the calories away, and most of them are found in protein. So protein is a very good macronutrient that will like people to eat more, especially for guys. Okay, if you need to feel full, okay, and then normally you have 2 bowls full of rice, try to switch more to protein. Okay, protein includes meat, eggs. Eggs is the best protein in terms of protein source. Tofu and also milk. Okay, they are good options for protein. Okay, so what is wrong with my eating habit? Okay, so this is the healthy plate. Okay, we call it what? Quarter, half. Okay, quarter goes to carbohydrates, good carbohydrates, low GI index carbohydrates. Okay, good source of protein, and also half of them should be fruit and vegetable. That's how you arrange your plate. Sadly, in Malaysia, normally it's half is the rice, right? And then another half is the meat and a few vegetable. That's our chicken rice. Okay, so we need to change it to quarter half. Okay, so there's three most must-know technique in healthy eating plate. Three must-know technique. First, control your carbohydrates. Okay, second, get the good stuff. Three, control your fat. Because essentially what we are eating every day, really essentially, is just carbohydrate, fat, and protein. Every time when you look at your phone, every time when you look at your food, classify them into what are they? Carbohydrate, protein, or fat. Then you decide what you want to take. Okay. First, I would like to highlight control your carbohydrates. How do you control? Okay, everyone, this is your breakfast every day. Okay, look at one pieces of apong bale is how many calories? 282 calories. Kueh lapis is 131 calories. Curry puff, never stop. You won't stop at one piece. You will always, auntie, dua curry puff. It's 256 calories. Okay, this is our carbohydrate calories. Okay, that we see. Compared to if you take a healthy breakfast, a fruit juice smoothie, okay, and maybe some healthy natural protein shake every day, you will actually also get 300 calories, but they are healthier option. So this is how you choose your carbohydrate. Let's look at some carbohydrate choices. Calorie for breakfast, according to guideline, you should keep it at 300 calories per day. Okay, a lot of people say that I'm not keeping fit. Okay, I'm healthy, I'm slim. Why do I need to know calories? Actually, we are using calories as a guide today, not only for you to be slim, but also for you to be healthy. A lot of unhealthy food are actually very high in calories. So in order for you to know whether are you eating healthily, you can refer to the calorie intake, calorie index, and then you will know whether are you eating it healthily. Okay. A lot of our common breakfast, one glass of Milo per day, is 140 calories, but how much of it are nutrients? It's very high in sodium, very high in sugar. So Milo is not a good option of breakfast. Okay, even crackers 75 calories and nasi lemak per pack is 350 calories. You're out of your breakfast boundary. Calories for lunch, according to guideline, is to keep it at 550 to 650 calories. Okay, that's what guideline. Look at one serving of fried chicken is 250. Fried rice is 600 calories. Okay, so it's good to know what are the calories of food that we are taking every meal. Okay, so how do you control your carbohydrates? Okay, first you need to limit your carbohydrates. Limit carbohydrate. Limit your carbohydrate. How do you limit? Okay, essentially everyone likes to eat lunch this way. A plate of fried rice, some veggie, some chicken, and then some fruits. Okay, all this add up is 950 calories. Okay, so how do you limit it? Maybe you can halve your fried rice, which is a very good option. Okay, remember, it's what? Quarter, half. Okay, carbohydrate should only be quarter. But start by doing it half. If you cut your fried rice by half, your calories immediately turn it from 900 to 600 calories. Okay, so how a better option will be to change your fried rice to a white rice. Okay, I always tell my friends and also my family, the number one thing that we should cut from our diet is fried rice, fried bihun, fried kway teow. Okay, because essentially they themselves already have high level of calories, and you go and fry them. On top of it, you go and fry them, there will be even more calories. So don't go for fried rice or fried kway teow or fried bihun. Just like how normal smart people are, especially, normal smart people, they will always know what to study first, what to focus on. We call it study smart. So when we eat also, we must eat smart. Why do we spend the same amount of calories? Why do we spend the same amount of food but different amount of calories, so much more? Okay, so the same, limit your carbohydrate, change it to a different option, a wiser option. Maybe white rice is 500 calories. So essentially, even if you eat so many things, it's 600 calories compared to one large plate of fried rice is 600 calories. So choose your calorie wisely too. And not only does the calorie matters, the nutrition value in the food matters a lot too. So you can compare both of this. Okay, so how do you control your carbohydrate? Carbohydrate, always, it's very easy from a healthy plate, it should be quarter. Okay, and also go for the healthy option of carbohydrate, low GI index, brown rice, okay, and also whole grain. Okay, so how do you look at carbohydrate? It's normally a fistful. Okay, that's your carbohydrate count. Okay, so one of the ways to limit, always cut it by half. the battlefields 2 scoop of carbohydrate is the best, okay? And also change to healthy option like chapati or dosa instead of roti canai. Okay. Second one, 3 must know technique I would like to tell is get the good stuff. Okay. What is the good stuff? Get the protein, the vegetable and the fruits. Remember, half of it should be vegetable and fruits. Okay. Protein, get fish, tofu, and also the eggs. They are very good option. So get the good protein in our daily lifestyle too. So protein, normally we use it as a palm, or your healthy plate, you can use it as a quarter. Your palm, vegetable should be 2 fistful and fruit should be 1 fistful. So this is our healthy diet that we are looking at. Okay. The third must know technique will be controlling your fats. Okay. Fats are good, but bad fats could be very sinister, especially just now the one that we talked, trans fat is really bad. So fat has the highest energy calorie intake among others. Okay, not only they also hurt your heart if you take it excessively, and they will also form with inflammation will form atherosclerosis in our vessels. Okay, so what is fat? Okay, fat, look at it. 1 plate of char kway teow have 5 teaspoons of oil. Okay, look at how they fry char kway teow. Okay, so normally we call it the traffic light system. Okay, red, we only eat it once in a month. Yellow, you eat it bi-weekly, and then green is the one that you can eat every time you want. So red traffic light system are actually the roti canai, char kway teow, curry meat. They are all very high in fats. Go for thosai. Okay, go for mee hoon soup. They are better options. Steamed fish, steamed chicken. Okay, and also definitely fried pomfret are very popular too in Malaysia. Go for steamed pomfret instead. Essentially, have the knowledge and go for the better choice and option. Okay, so always fat is only harmful. Okay, tongue tip also maybe. Okay, okay. So what I would like to say is that what are the healthy eating tips? Okay, I always say that again. Just now we said knowledge make up choice, choice make up habit. Okay, so always go for the healthier choice. It's the most important. Okay, use healthy plates to control portion and never skip breakfast. Okay, breakfast should be always a healthier meal. I always tell my friends and also my family, a very useful tip in keeping ourselves healthy is before 12 p.m. never go for unhealthy food. Go for good food, okay, nutritious food before 12 p.m. every morning. Okay, nowadays people even use those intermittent fasting. Okay, the first meal that they eat, you look at those people intermittent fasting are always nutritious full food. Okay, why is breakfast so important? Because you have been sleeping the whole night. All your cells are hunger for nutrition. So if you take char kway teow and nasi lemak as your first meal, all of the fat will seep into your cells. They will absorb it immediately. So always choose the healthier option. Okay, okay. One of the things is understand yourself. Which type of cluster of people are you? And do you want to lead a healthy lifestyle? Okay, don't eat while you're on the phone and you're working. You will eat non-stop or you're studying, and learn to snack healthily. Okay, actually snacking actually contribute a very huge option to our food too. Okay, the most important meal again I would like to remind a lot of people is a breakfast. Okay, always choose a healthy option of breakfast. Eat fruits, fruit juices. Oats is very good in controlling cholesterol and also hypertension. Okay, they are very good option. Okay. And for hypertension especially, go for low salt food. Okay, cook at home, that's a very good option. Okay, what I would like to highlight is, so I have a very good friend who is working as an ICU nurse in Singapore. Okay, she always show me food in Singapore hospital. Look at them. Okay, to your patients. Sometimes when I look at the meal served in hospital to my patient, also I'll be a bit like, oh my god. Okay, they are eating fried bihun, fried rice as their hospital meal, and that is the time that their body need all those nutritional food to build their immune system and also replace their dead cells, especially those ongoing chemo. So what you take actually build your body. Reminders to all of us Malaysians to go for healthier option. Okay, and a lot of friends say that, oh, I don't have time to cook. Okay, cooking takes up a whole day, is too busy. Okay, but these are foods that me and my friend we try to prepare sometimes on our off day and when we are free. Okay, they don't really take a lot of time. It's actually how we use it. Try to do easy cooking. Go for easy option. Like I like to cook a lot of things in the pot. Okay, do I cook every day? I don't. Okay, so we don't really have the time to cook every day too. But what I would like to remind others is that try to make time for some healthy cooking. And then cooking can be fun too. My best friend, which I mentioned, Wen Jing, she's an ICU nurse in Singapore. One of her favorite thing is actually organizing plates. It helps her to distress too. So actually, cooking healthily may be a way to distress and lead a healthy lifestyle too. Okay. Okay. So what I would like to tell you, when in the end, eating all comes to our choice. Whether you want to have a meal of fast food or a full day of eating with healthy food every day. Of course, a lot of fitness people, you can ask them, they go for cheat day. It's normal to have a cheat day. So you can have whatever you want. I practice that myself, to go for a cheat day and eat what you want. But on normal days, try to go for healthier choice. And how do you succeed at home? Stick to a routine. Really, go for a healthy routine that eat as breakfast every day. I think it's very useful for me. I stick to a normal, healthy breakfast routine. Okay, avoid excessive snacking and binge eating. So wait for your cheat day. Okay, and don't criticize yourself too much. Give yourself space and time to grow as an individual. Okay, what I always like to tell my fellow patients, okay, and also fellow family and relatives, 生病早医生，健康靠自己。Your health is in your own hands. When you're sick, you look for the doctor. Definitely follow the doctor advice, okay? And also their medication, because you are sick already, okay? But if you are healthy and you're on the binge of getting sick, that means you're suboptimal health condition. You can look at this up in the application. What is suboptimal health condition? That means you feel tired all the time. You feel lethargic. You don't have energy, not interested in everything. This kind of suboptimal health condition, you need to put this in your own hands, okay? Because if we can't, doctor, we are just treating a lot of your signs and symptoms and also your lab results, okay? But if you are someone that's healthy, you don't have, it doesn't show on your blood investigation yet. It's time for you to take health in your own hands. And for my fellow friends and my colleagues, I always tell them, it's our responsibility as a doctor to change and also influence our patient to lead a healthier lifestyle too. And that is a lot through healthy eating, okay? Because they believe in us. But sadly, we are sometimes our med school doesn't focus a lot on our nutritional knowledge because we have so much to study on. So sometimes having nutrition knowledge as a doctor and also be more open-minded about how to eat healthily and also how food helps to build our body is very important to our patient too, because essentially food is actually the best medicine for our body. Okay, so health is wealth. What are you doing for your health? I always like to ask fellow patient, what are you doing for your health? Okay, so what is the take-home message I would like to give everyone today? To combat hypertension, your best protection is actually knowledge. Okay, attend more public health events. Be open to healthy eating. And of course, knowledge comes from the right source. To make sure you have the right source of knowledge, okay? And also management and prevention, okay? By doing this, you're actually doing your health a big favor, okay? Because optimal health requires knowledge to remove ignorance, discipline, okay? Commitment, patience, and also a group of like-minded people. So why don't, after today, I hope that each and every one of us can be the person who started this healthy eating mindset in our friends and among our friends little group, okay? Because asking everyone to binge eating is always the easiest, but trying to change, trying to motivate everyone to be healthier, you will feel more fulfilled in your life. Okay, I guess this is all that I would like to share today. I always tell my fellow friend, a little change in our daily life at the beginning, it's very tough. I admit that it's very tough to make little small changes in our life. But when you start to do little baby steps, take baby steps, okay? And award yourself for baby steps. After the baby step, try to make it a habit. And by cultivating the habit, you will have a healthy lifestyle. So by doing this, it's definitely more worthwhile than spending your later years in hospital. A lot of my patients spend most of their time coming for follow-up in clinics. And they will say one of their most traumatic experience will be blood taking in the hospital and setting the IV lines. This pain, I think these pains and this hustle in our later life, when we are old and we hope to be enjoying life, all this is a worthwhile, I think it's a for me, I would think it will be a better thing for me to work hard and then cultivate better lifestyle now, it will be worth it compared to spending all my olden days in the hospital. Okay, I guess that's my sharing for today, and I hope that I bring you awareness in how a healthy eating habit can can help us in combating hypertension. Okay, thank you.
Thank you, Dr. Chin, for the enlightening session. Now we will have questions from the floor. Dear viewers, please ask your questions by typing in the comment section, and we will highlight the questions to Dr. Chin.
While we're waiting for the question, I would like to ask Dr. Chin some personal questions. How do you feel about active charcoal, about delivering to the patients in order to minimize the oils and fats? Is it healthier in the long term?
Sorry, I think the connection is a bit bad. I didn't get your question. Can you repeat, please?
Okay, I was talking about active charcoal. There's a lot of hype these days. They got charcoal breads and everything about charcoal. So how do you think about that as our diet? Is it beneficial or detrimental in the long term?
I will say for charcoal food, if you use the charcoal as a coloring for the food, a lot of sponge cake, they come with charcoal sponge cake option, but they're actually just sponge cake essentially, with a lot of sugars and a lot of salts and a lot of simple carbohydrates. Yeah, use it as a coloring and also flavoring. It doesn't actually make a huge difference, especially in a lot of processed bread. Okay, but if you're eating a whole meal, a healthy charcoal bread, I think that will be actually okay in terms of that. Yeah, so it depends on how to make the food too. Essentially, how we cook our food is very important to us.
Okay,
Does that answer your question?
Yes, thank you very much, Dr. Chen.
So, Dr. Chin, we have a question from the floor. Is atherosclerosis reversible?
Okay. First, I'd like to see what degree of arteriosclerosis do you have? For example, a lot of my patients come in with triple vessel disease block. That means all three of their vessels are blocked with severe arteriosclerosis. And at this stage, is it reversible? I would say no. You may need to go for coronary bypass. You may need to go for the medical option. But if you are just someone who have some little block, okay, and then very mild block, and then you are still actually just essentially overweight and obese at the moment, yes, is it reversible? I would say definitely yes, but you must first change your eating habit, and the 6 pillars for optimal health, they are very important. Essentially for arteriosclerosis, having a healthy diet is very important, and I personally come across a lot of patients by changing their eating habit, and with the help of some nutritional knowledge, they actually improve a lot even without medical treatment. Okay, but that again depends on the degree of your blockage. Okay, so again, you can consult not only the doctors, because not all doctors have nutritional knowledge. You can consult the doctors, you can consult the dietitian, and also nutritionist too. I think that would be a very good all-rounded consultation.
All right, thank you very much. So I'd like to go on with another question from the floor. Is it good to take beta-glucan oats to reduce blood cholesterol level?
Beta-glucan oats, is it?
Yes.
I would say, I think beta-glucan, I know, essentially I would say oats are good in reducing blood cholesterol. Okay, they are good in reducing our, because oats tend to it will take in a lot of body fats and also lipids. So they are a good option for people with high blood cholesterol. Okay, but oats beta-glucan, some of them is actually essentially, I don't know whether is it a brand, but they are more of a natural soluble fiber. Fiber helps to take in a lot of body fat. So if you are someone who can tolerate oats, okay, and also because not everyone can tolerate oats actually essentially. Okay, and then if you are someone who wants a healthy lifestyle, you can opt it as your breakfast. But do remember that you need to go for those natural, non-processed good oats, not those instant oats that are very full with sugar. Those 3-in-1, those are not the good options out.
Okay, thank you, Dr. Chin, for the explanation. So we have another interesting question from the floor, which is on hyperactivity. So the question is, can healthy eating habits be a cure for hyperactivity?
Okay. I know that person who is asking the question, Brandon Lim Dasing. Okay, for Brandon Lim Dasing question, first, Brandon, you're very hyperactive, is it? Okay, I'll say healthy. Okay, for young. Okay, on a serious note, for hyperactive kids at a very young age, actually healthy eating habits definitely does help them. Okay, a lot of parents tend to give their young children a lot of high sugar intake food. High sugar does promote hyperactivity in younger children. Okay, high sugar, they have a lot of those spike in sugar levels. So those kids will tend to, after taking ice cream and sugar, you will see them being very active. So this does cause that too. Okay, I hope I answered Brandon's question. Brandon?
All right, thank you very much, Dr. Chin. Now we'd like to go on to a new question. Now you mentioned like visceral fat, right? Is it necessary that it always associate with obesity? And so is it possible for a non-obese person to have high visceral fat as well?
Yes, actually, the answer is yes. Very straightforward. I have seen a lot of people who is very slim but have very high visceral fat. Especially for those people, unfortunately, a lot of people who go to the gym, but they don't choose their protein wisely, because a lot of gym people are taking whey protein, and whey protein are actually very high in fats. They're actually essentially milks. They are from milk. They're taking as the source of protein. So having a lot of gym people are very fit, but when you look at their visceral fat level, they have very high visceral fat level, even a fatty liver to some extent. Okay, so it's very possible to be of someone who is very slim but can have very high visceral fat level. Another good example will be people, and also people who have genes. There are people with genes who is very slim on their family. You can't find someone who is very fat. In their whole family history, everyone is just so slim, but they eat nasi lemak every day. For this kind of people, yes, they are very fortunate to be born with good genes, to be very slim. But if your eating habit is not healthy, I would say a visceral fat level is actually a more accurate way to measure whether are you having very high level of fat in your body.
All right.
Thank you, Dr. Chin, for the explanation. So we have another question from the floor on our diet plans. So the question is, which one is better, high protein diet or low carbs diet plan? And I think we could also add the ketogenic diet plan together with the question. So which one do you think is better?
Okay. I would say this one comes with a lot of argument, and you will see a lot of research and also report on these diet plans nowadays. We have a lot of diet plans nowadays. We have ketogenic diet, we have high protein diet, we have calorie counting diet. We even have intermittent fasting. I think this is essentially the most popular diets that we're seeing in the market nowadays. Okay. First, I would like to remind, whatever diet you are going on, you must make sure that you don't have any underlying medical illness. Okay. If your doctor advise against it. For example, high protein diet may not be suitable for people with chronic kidney disease. So does that mean that high protein diet is not a good option? Definitely not. It's just not suitable for certain people with certain medical illness. So first, you must make sure that you don't have that medical illness. Because some medical illness have big contraindication to certain food. Okay, so putting that medical illness part aside. Okay, between these different diets, how do you see? First thing I would like to highlight is that moderation always is the best way in all type of diet. Moderate intake, I would say moderate diet is the best option. If you are someone who go keto until too extreme, I do not agree with it. Or even protein until a certain extreme, you don't take a drop of carbohydrate, I do not agree to that too. I always believe in moderation. Okay. Second, whether which options that it actually depends on you personally, your body type. Okay. I tend to go for high protein diet. First, it's easily accessible. I believe that it's more health benefit for me myself. Okay, and then I will also think that it's easier than ketogenic diet lah. Okay, I also do try to adhere to some of calorie counting. Okay, for intermittent fasting, okay, it's very popular nowadays. A lot of people are using it. The problem with it is, first of all, not the concept about intermittent fasting is that you only eat for 8 hours, the other hours you're fasting. But the 8 hours that you're eating, essentially you should be eating high nutritionist food. Okay, a lot of people tend to be fasting for the eating for 8 hours, but they're eating very, very unhealthy food, and this doesn't help in their diet. And the problem with intermittent fasting is that you couldn't do it for a long time. Okay, a lot of people will just do it for 2 months and then stop it. Okay, so if you're looking for a short diet plan, you want to get slim, okay, then you may opt for intermittent fasting, but do it rightly. But whether is it a long-term workable option, you may need to think about it, because a lot of people find it very tedious to go on with it. Okay, as for ketogenic diet, the question about high protein diet plan or low carbs diet plan. When you have high protein diet, you're actually having low carbs, because you still need your daily calorie intake. So what we are saying is that you replace your carbo, and then instead of taking carbohydrates, you take protein. So they are actually the same diet plan now. So if you are just looking for a healthy lifestyle, generally, I think it's a good option to go for high protein and low carbs diet. And choose your carbs. Okay, last but not least, ketogenic diet. Ketogenic diet was very popular at one time, very, very popular. You need to take a lot of fats, essentially. If you want your body to go into ketosis, that means you burn all your fats. Okay, I'm not someone, I've never done ketogenic diet before. Okay, and why didn't I do it? Because personally, I think that looking for the right fat and the good fat is very difficult. And even if you want to eat so much fat in a day, they actually essentially take omega-3, oil and olive oil. I think it's a bit difficult for me. Okay, but if you are doing ketogenic diet not the right way, you are taking a lot of fats from meat. That is not a good way. Okay, because it's not good for your heart. Okay, so for me, ketogenic diet, if you're someone who is really very fat, is very effective from what I read. But remember, how does fat affect your heart too? So remember to go for the right fats. That will be very nice. Okay.
All right. Oh, all right. Sorry, I was looking at another question. So, Dr. Shin, should parboiled rice should be a good substitute for red rice? Pre-boiled. Okay. Is it pre-boiled?
It's pre or parboiled?
It's pre-boiled rice. Yes. Yeah.
I think
all right.
Rice that are partially boiled in husk is something like that. I think they are not those finely grained. They are not fully processed rice. If I didn't think that they are just not whole grain, but they are like partially processed rice, I would say. Okay. For parboiled rice, the substitute for red rice. I see a lot of red rice in the market nowadays, multi-grain rice, red rice. Personally, I did try that before, and I think red rice is quite a good option, very low GI index, and very popular among those people who do organic eating nowadays. So whether is it, I personally like red rice a lot, and I don't know what's the contraindication for substituting it, because essentially healthy diet and also eating habits is a very wide and broad range of subjects. So if Gomati actually does know what is the contraindication in taking red rice, or what make red rice not a good option, maybe he or she can share it with us. But personally, I like red rice, and parboiled rice, I'm not really that familiar with it. I just know that it's not a rice with the husk, that's called. Yeah. Sorry, I don't know much about this.
I think there's another similar question from Miss Gomadi as well. It's with parboiled rice be a good substitute for brown rice as well?
For brown rice as well. But I'm not really sure about what's the hype with parboiled rice, because for me, brown rice and red rice are really very good options, which I really take. Maybe if they do have the knowledge, they can share it with me here. I would like to know about that too, actually.
Okay. Any questions? All right, so we can move on to Ninjata Rajendran. How do you reduce craft craving for food and binge eating? How do you reduce the cravings?
Cravings for food, is it? Okay, that's the most difficult thing to do in discipline eating. Okay, what I will suggest is go for healthy snacks. Okay, the first thing is that your main meals, you cannot be hungry. If you don't eat enough for your main meals, you will definitely be very hungry and then you tend to have a lot of cravings. So make sure that when you have your lunch, of course you go for the healthy plates, but you must be full. So how do you make sure you are full? If you cut down your carbs, remember to replace them with proteins. Okay, don't say that I'm only eating very small portion. That's a bit it's not going to be long term. I always believe that in order to have a healthy diet and eating habit lifestyle, that it needs to be able to sustain for a long term period of time. If you can only do it for 2-3 days, I don't think it's worth something that's cultivated lifestyle now. Okay, so first make sure that you're full during your main meals. Eat the 3 main meals per day. Okay, if you're not doing intermittent fasting, make sure breakfast you are full. Then you won't think of cravings. Second thing is that you can have healthy snacking. So what are healthy snacks? Very popular with the gym population. Our fitness people are eggs. They actually do hard-boiled eggs for for snacks. Okay, or you can actually go for nuts. A lot of those healthy nuts, almond, cashew nuts, all those nuts. Okay, essentially healthy eating. This actually costs more from the pocket. I would say that, but always listen. Okay, always listen. When you're in your old age, if you don't pay for your healthy eating in your younger age, you need to pay for medical fee when you're older, and that really costs much more. Okay? So although nuts are a bit expensive, it's a good option. You can go for fruits, guavas, mangoes for young people, they are good. Okay, fruits, and also even apple, orange, they're all very good fruits. Very cheap, very good fruit, especially apple. Okay, and then bananas and you can go for chia seeds. Chia seeds is very filling. You can even mix it in the water to make it like a jelly-like thing, and then you can eat. Chia seeds is a good option. And those healthy snack bars, not those very sweet and high in calories. Choose the healthy snacks bar. And I would say, what more do I eat for snacks? I think that vegetables, if you take snacks, avocados. Okay, those are those snacks that we have. Okay, or dark chocolate can be a good option too.
Thank you, Dr. Chin. So speaking of eggs, we have an earlier question from the floor of, is eggs suitable for hypertension and how many eggs can we eat maximum per day?
Okay, about the myth about eggs, the number one thing that I want to highlight is that how we cook the egg is very, very important. Okay, if you fry the egg, the calories triple. Okay, and the cholesterol triple too. So if you are someone with high cholesterol and also hypertension, don't ever fry your egg. Scrambled egg, the sunny side up, they are all fried eggs, all no. Okay, so if you have hypertension, doesn't mean that you cannot take egg, but don't fry your eggs. Okay, but egg is a very good source of protein. It actually have PDCAS score of 1. That means it really absorbs really well in our body. And if you are someone who is good, trying to keep healthy, egg is a very good option and a lot of substitute in a lot of things. So if you have hypertension, you can eat eggs, but eat it cautiously. I'll say if you doesn't have very bad hypertension, you can still eat 1 per day hard-boiled egg. It's fine. Okay.
How about hard-boiled egg?
Hard-boiled egg is good too. Okay, but make sure your egg is fresh.
Okay.
Okay, especially for those medical students time when you keep your egg for 1 month in the fridge, then those egg is not really suitable for hard-boiled egg.
Okay. So is there any questions left? Okay. Which one is better, high protein diet or low carbs plant diet for weight loss? What's your question? What's your answer?
Okay, for weight loss, actually, essentially high protein diet and low carbs diet is actually the same. I think I explained that just now, because in order for you to have low carbs diet, you have to substitute the low carbs. Okay, and how do you substitute the low carbs? You need to have high protein. Okay, if you don't have any contraindicated medical illness, high protein diet and low carb diets are actually the best combination. And choose your carbohydrate wisely, and also exercise. Remember, optimal health is 6 pillars. In order for weight loss, if you don't do exercise, it's kind of impossible, to be honest. Even though throughout the whole decade, humans have been trying ways to avoid exercise, but exercise is ultimately still the answer, unfortunately. Because if you have seen the balance that I showed just now, all our input depends on what we eat. But one of the very essential output is actually exercise. And exercise is one of the 6 pillars for optimal health too. Okay, it compromises 30% for our optimal health. So exercise is very important. Okay. Anything else?
Thank you, Dr. Chin. Now we have one last question from the floor. That is, what are your takes on barrio rice?
Wow, we Malaysian really like rice a lot. I see a lot of questions about different type of rice. Okay, essentially, remember, I think the first answer will be rice are actually still all carbohydrates, and then we are asking for low carbs and then higher protein intake for people with no underlying medical illness. So essentially, you still have to cut your rice. It should only be quarter of your plates. Okay. Second will be, I think barrio rice is actually those rice that's locally produced with no pesticides and no herbicides. So it's just like kind of like organic rice that we call. Okay. But for barrio rice, it is still a white rice. If you're still going for the white rice option, it's still white rice, but organic produced white rice. If you can go for brown rice that doesn't have pesticide and also herbicide, that will be a good option. I think that will be a better option. Okay. Essentially, you need to categorize what type of rice it is.
Okay. Lastly, how much is a visceral fat is considered high?
How much visceral fat is considered high? Okay. For youngster, I would say more than 5 is high. For young people below the age of 30, more than 5 is actually high. Okay. For me, my visceral fat level, I always keep it in track, is 2. Okay, for youngster, you should be less than 5. Okay, but for older age people, because your visceral fat does build up over the age. Okay, for visceral fat for older people, normally the standard guideline is less than 10. Okay.
So that's all for today for our questionnaires. Okay. So once again, a very big thank you to Dr. Chin for sharing her expertise on dietary habits and how can we improve them. It's a really eye-opener in many ways, and it's an honor to host her.
Okay, and then I thank Quest University very much too for the invitation. You guys are doing a great job. As youngster, you are doing a great job. Keep it on. Okay?
Thank you, Dr. Chin.
Okay. I'll see you next time.
Yes.
Okay, we meet next time.
Goodbye.
Okay. So everyone, I would like to remind that we have a quiz at the end of this session today. So the link will be shared in a while. So please stay online and please participate in the quiz. There are prizes provided for winners. And we have shared the link in the comment section. So please click the link in the comment section and participate in the quiz. And probably you can win the prizes. Yeah, the winners for the quiz will be announced on Monday. And I repeat, there are prizes provided, so please participate in the quiz. The link is provided in the comment. So on that note, I think it's time to wrap up day 1 of our campaign. We are so grateful for all your support, especially to those of you who have been tuning in from this morning. We have reached the end of our 5th live session for the day.
And once again, I would like to remind everyone to participate in the fitness hashtag challenge. Make sure to subscribe and follow our page in Instagram and Facebook with the username at PHC2020QIU. Okay?
We are going to have 5 live sessions tomorrow, starting with the first live LT eating session at 9 a.m. So see you guys tomorrow. Please stay tuned for more updates in our Instagram and Facebook. I repeat, our first session tomorrow is at 9 a.m. Please tune in to our live session tomorrow for our first episode of LT eating session tomorrow.